Here at the Melanin Initiative, we simplify medical information into language you can understand. We create a safe space to ask your questions and share a nursing perspective. Today, we'll be talking about vitamin D deficiency, women's health, and why this overlooked nutrient plays a critical role in breast cancer, pregnancy outcomes, and lifelong health equity with our special guest, Dr. Nikisa Rogers, a board-certified radiologist specializing in breast imaging and a strong advocate for women's health, emphasizing the importance of vitamin D from the womb to the tomb, a topic we can all learn a lot about, even those of us in healthcare. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it, to manage your health and advocate for others. We have two missions here. The first one is to promote that health literacy. The second is to elevate the expertise of nurses, bring awareness to all the diverse career opportunities in healthcare, and then to let our clinician friends know all the different ways that they can leverage their expertise, both as clinicians and entrepreneurs. If you're new here, this is your chance to subscribe. Leave us a thumbs up, put a comment down there, follow us on Apple and Spotify, give us a 5-star review. When you interact with our platform like that, it lets the algorithm know that this information is important so that when people like you look for topics like this, we'll show up higher in the search results. Remember, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you think you might be experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you think you might be having a physical emergency, you should call 911. If you or someone you know might be having a mental health emergency, you can call 988 or text 741-741. Today, I'm joined by Dr. Nikisa Rogers, a board-certified radiologist specializing in breast imaging at Radiology of Indiana. She earned her Bachelor of Science in Bioengineering from Washington University in St. Louis and completed her Doctor of Medicine at Indiana University School of Medicine. Dr. Rogers' commitment to patient care and public health sparked her passion for studying vitamin D deficiency as a contributing factor in early onset breast cancer and rising maternal mortality rates, particularly in underserved communities. She founded Crossroads Health Foundation, Incorporated, a nonprofit dedicated to advocating for vitamin D sufficiency from the womb to the tomb. Her advocacy has taken her from the Indiana State House to the national stage. She has presented to women's groups, national organizations, and joined Grassroots Health in Washington, D.C. to call for updated maternal vitamin D testing guidelines. With a vision that merges diagnostics, advocacy, and community health, Dr. Rogers is leading a movement toward lifelong health equity. Dr. Rogers, welcome to the Melanin Initiative.
Thank you. So glad to join you today.
Yes, it's wonderful to have you here. We met not too long ago, and I was telling her that my first contract as a travel nurse was in Indianapolis, Indiana, a really fabulous experience. The people were so kind, and I was really surprised at how many Black people I saw there. Are you born and raised in Indiana?
I am. I was born in a small town north of about an hour north of Indianapolis, and then we moved here to Indianapolis in the 6th grade.
Oh, okay. Yeah, I just loved it there. I lived downtown near the canal, and I would walk to the hospital. It was a lovely walk, and I loved the canal.
It's beautiful there.
Yeah, great walking city and really good food. So before we get into our topic for today, we're going to just do our little icebreaker, which is a chance to get to know you a little bit on the personal side.
Sure.
So it's 5 questions, 5 minutes. Don't overthink it. It's supposed to be the fun part of the interview. Okay?
Okay.
This one's going to hit home really quickly, okay? As high achievers, sometimes we spend more time focusing on the next thing rather than celebrating what we've already accomplished. Dr. Rogers, how do you stay present?
By counting my blessings every day. I'm so grateful to just be alive every morning. I just wake up. I'm just thankful. I'm thankful to, have my health, that I'm in my right mind, and just the gratitude that I still have all my children. I'm still married. So I think being present means just having gratitude and just kind of keeps you in the moment.
How many children do you have?
I have 4 sons, age 23, 19, 17, and 13.
Oh, you're still in it.
I'm still in the trenches, but I'm kind of like on the home stretch because I have 3 drivers now.
Oh, yay. Hey, we love to hear it. What's the next big idea you want to be part of?
Changing the federal guidelines as it pertains to what they consider sufficient vitamin D levels for maternal health and for general health.
Okay. The most important thing you've learned about communication?
Is that you have to talk at a level that most people understand. That as doctors, sometimes we can overly think things and we can use big terms and big language, and that creates a barrier between you and the other person that's listening. So that's what I try to make sure I do. That I try to talk plainly, just how I would talk to my family members. So you may hear me say "ain't" or or just because I just like to just have a conversation as I'm talking to my patients and colleagues.
And we all appreciate that. Speaking of your family, does this principle that you have about communication, have you seen the same thing in your marriage?
At times, sometimes better than others. I think that my husband is definitely a big talker, so he sometimes he talks more than me. So so oftentimes we're kind of like there's a little bit of a struggle to share the conversation floor, and sometimes I have to say, okay, you've spoken, it's my turn. So,
I
but yeah,
like
I try to keep communication is a big part of marriages for sure.
Yeah, I like that. The communication floor. I like that. So, one of our series that we have right now is called Becoming a Physician with a young man named Clarence Sams. He's from New York. His late father was a nurse practitioner. He attends Charles R. Drew Science and Medicine. It's a HBCU in California, and he is the founder of their dermatology interest group. He's been coming on to this show for over a year now. He's entering his third year as a medical student. What advice would you have for Clarence at this time in his journey, considering the experiences that you've had?
Um, yes, you just have to get through it. So I would say medical school, there are a lot of challenges, and the main thing is just you kind of put your best foot forward and just try to take it all in. But mainly, you just have to get through it. You have to pass all your board certification tests. You just have to make it to the next level. And you have lots of examples that is very possible and very achievable. And I would just say definitely try to stay within groups. So have study groups. Some of my study partners are still good friends to me to this day. And actually, one I'm joining at Capitol Hill this coming week. So I would say just having study partners really, really helped me. Just quick funny story. I remember when I was in medical school, we were on neuroanatomy, and that was like one of the most challenging classes that we had. And I had missed the lecture. It was my fault. And so, and so when I went back to the following lecture, I had no idea what was going on. And I was there and I was completely lost. And I was so anxious because I'm like, oh my gosh, what's happening? So I go to the library, I see one of my friends, and I go in there, I talk to her, and she just broke everything down to me, explained it. I figured out we were actually in the brain and spinal cord. And then I just took that and just kind of ran with it. So I would say just having the support of people, like-minded people that are doing the same things you're doing was instrumental.
I think that's key for marriage, nursing, medicine, and entrepreneurship. Yeah, because we're not meant to do this alone, right? We're social beings for a reason. And then the last question, one of my favorites, what season are you in now?
Season of my life, or see, what do you mean?
However you interpret it.
Well, I'm in the season of I'm over the toughest part. Well, I'm over the big chunk of raising small kids. And so I'm entering that next phase of what it's like to parent kids and young adults. And so I feel like now this is my time to explore my passions beyond my current job or things that I've typically done. So that's the season I feel like I'm in to explore. I'm in that phase of being postmenopausal, so I'm exploring all the intricacies of dealing with that. So, but yeah, it's good right now.
And in that regard, are you part of a group also of other postmenopausal women, since you talked about the power of community?
Yeah, well, my so I have a I am, because I'm kind of like leading my group of friends, like the ones that are a little bit younger than me, and also the ones that are postmenopausal that aren't taking hormones. I'm a big hormone person, and they've changed my life. And so I try to bring other people along so they don't have to suffer. And so actually one of my next talks that I'm going to be doing is called Optional Suffering, Opt Out Cis. And so and I'm going to talk about hormone replacement therapy and try to talk about all the nuance, and so that we don't have to go on in ignorance anymore. So that's one of the big areas that I would like to focus on beyond the vitamin D.
Wow. Well, hey, folks, she'll be back to talk, to talk about postmenopausal. And say that phrase again?
I call it optional suffering, opt out cis.
Optional
Make
suffering.
optional suffering, opt out cis, make your next chapter your best chapter.
Wow. You came up with that by yourself?
I sure did.
Wow. I love it. All right. Are you on social media?
Okay, so my kids have set up social media accounts for me. So they did that about a month ago. So now I'm just at the stage where, okay, I need to start really growing the social media. And quite honestly, I've not made a lot of time to do it. But now that I'm on this podcast, I know it's very vitally important. And actually, one of my sons, my oldest son, he just graduated with a degree in computer science, and he's working on a website for me. So I just told him, I said, okay, this is a big deal. We need to go ahead and get finished with this project. So yes, I plan to increase my social media presence here in short order.
And we'll be hearing opt out cis all over the place. And then when you go to Capitol Hill, great opportunity to get some content. If you don't already have a camera, don't worry about it. Just use your phone. Lots of little reels. Talk to the camera directly. Talk about your experience. Don't overthink it.
Okay. Okay.
Okay. Lots of pictures. You have a bunch of still photos you can put with words later.
Okay.
Yeah. Okay, so this is a huge topic, and one we kind of underappreciate in medicine because it hasn't been given enough attention. You and Dr. Beth Sanford opened my eyes big time during our brainstorming session. So I'm so excited to bring this to our audience and to encourage conversation, especially for those of us who are practicing and who are kind of have that knowledge deficit and don't even know it. So we're going to do our case study. I put quite a bit of, this is a little bit of a longer case study than we usually have, but I think because of all the information that you guys shared, I think it's really important. And it's going to really help us see how vitamin D really does impact the whole system. So our case study today, her name is Jasmine. She's 28 years old. She's a first-time mom living in Indianapolis, Indiana, in a historically Black neighborhood where access to specialty care is limited. She works full-time at a warehouse distribution center and has Medicaid. She believes that she's pretty healthy because she doesn't smoke, she drinks only occasionally, and walks a lot at work. She assumes prenatal vitamins are enough and has never heard of that vitamin D testing that might be important during pregnancy. She believes she gets enough vitamin D because she spends her breaks outdoors, though she often wears sunscreen in the summer. By her second semester, Jasmine starts experiencing fatigue, muscle aches, mood swings, which she chalks up to normal pregnancy symptoms. She also reports occasional high blood pressure readings at her prenatal visits, but hasn't been told vitamin D could be a factor. Near her third trimester, she develops swelling in her feet and headaches and early signs of preeclampsia. She's been very proactive about following advice she finds on social media, especially TikTok and Instagram. She follows several wellness influencers who suggest natural pregnancy hacks, like drinking herbal teas, using essential oils, and getting just 10 minutes of sun for vitamin D. She has not asked her OBGYN for a vitamin D test because she doesn't realize it's an option. When her mother-in-law mentioned weak bones being related to vitamin D, Jasmine dismissed it as outdated information. She continues to consume a lot of content that prioritizes holistic remedies but lacks scientific accuracy. She saw a viral TikTok video claiming vitamin D supplements are overhyped and can be harmful if taken in high doses, so she avoided them. She also joined a Facebook moms group where peers frequently share misinformation, such as Black women don't need supplements because our melanin protects us. After delivery, she's diagnosed with preeclampsia, or at delivery, leading to early delivery at 34 weeks. Her baby spends time in the NICU with low birth weight and feeding difficulties. Postpartum testing reveals that her vitamin D level is severely deficient, raising concerns for her long-term bone health and future risk of breast cancer. Dr. Rogers, if Jasmine had been tested for vitamin D earlier in her pregnancy, how might that have changed her outcome?
Okay, there's a lot to unpack there. So the way it could have improved her outcome, number one, Vitamin D is critical in the development of the placental and placental implantation in the uterus. So, vitamin D, being sufficient of vitamin D, having a level above 40 specifically, that has been shown to give maximal protection against pregnancy related complications such as preeclampsia, preterm birth, um, and as well as multiple conditions in the fetus as well. So those are like a few of the highlights. But the important thing she needs to understand is that vitamin D is very active in the blood. So our bodies take in vitamin D, primarily vitamin D3 from the sun. So, and we need adequate UVB in order to absorb the vitamin D. And actually, the UVB is only present when the UV index is at a level of 3 or higher. So, if you're in a state where your index is below 3 during certain months, you're not even getting the UVB to even make the vitamin D. So that's for starters. So you have to be in an area where you're even going to have the UV index high enough to even make the vitamin D. And then the darker skin tone you have, what you need to understand is that melanin in the skin actually blocks or absorbs the UVB rays. And where this chemical reaction is happening in the skin is at the lower level of the skin. So the UVB rays are having difficulty making it to that level to make the vitamin D adequately. That's why here, for most people, supplementation will be the only route you'll be able to get adequate vitamin D. So that's for starters. Beyond that, once your body takes in the vitamin D that you need, it actually is converted to an active hormone form, and that's called calcitriol. And calcitriol is what's active and goes through the placenta to the fetus and also stays in the placenta to make sure the placenta is healthy. So people that go on to develop issues with the placenta and preeclampsia, those types of things, it's a lot of times can be related to the fact that they don't have adequate of that calcitriol operating on the placenta and whatnot. And then again, the fetus cannot make the 25 hydroxy or the calcidiol itself. It actually relies on it to come from the mother. And once the vitamin D is in the fetus, then it can convert it to the active hormone form. And then it can, once the active hormone form is within the fetus, then it's able to contribute to the appropriate immune function and appropriate development of the lungs, neurocognitive development. So it really does impact all areas of our body. Receptors are what we find on the surface of cells, and receptors are what determines how active a cell is. And certain things like in the blood, like vitamin D, acts on these receptors. So vitamin D really does act on receptors that are in virtually every tissue of the body. So that's why it's vitally important that you have adequate vitamin D.
And how early in a pregnancy should a woman get tested?
To be honest with you should be getting tested before you become pregnant.
Hey.
Because for lung development, what they're finding is that the early in like very beginning, within weeks, that's when you're getting some lung development within the fetus, and having insufficient vitamin D is what's contributing to long-term development of childhood asthma, wheezing as infants, and childhood asthma. So what they are finding is that you can, like if you miss that window, it's like a window of opportunity almost for lung development. And once you miss that window of opportunity, you can give supplementation later, but that's not necessarily impacting or lowering your risk for developing asthma later. So that's why you really should be sufficient prior to getting pregnant.
Okay, and you kind of touched on this a little bit, but many people just think just that a little sun is enough. Why isn't that true for Jasmine and women like her?
Well, again, Jasmine has melanin in her skin, so for her, what she would need to do, to be honest with you, a group studied East African tribes. Like one of the tribes they studied was the Maasai people, and they lived traditionally out in the bush. And what they found was that their walking around vitamin D level was like between 40 and 60, but they spend most of the day out in the sun, and they're in Africa where you're near the equator, so you're getting really intense tropical UV sunlight. So, but when they went and tested the African people that lived in the city, 67% of those people were deficient. And that's simply due to the time spent indoors. So, for people that look like us, to get the adequate vitamin D from the sun, we would either have to relocate to Africa and live traditionally out in the bush, or we have to supplement.
Thank you. So, some people believe vitamin D is just for bone health. How does it connect to pregnancy and overall women's health?
Vitamin D is used in virtually every tissue in the body, from the brain all the way down through your muscles. It's involved in your immune system. It's involved in being able to fight off infections, lowering your risk for cancer. So it really does impact every aspect of our health, and it's underappreciated.
Why?
The I think okay. So if to really talk about vitamin D, you really should go back to the beginning where the history of vitamin D, and it was based upon the disease of the day, which in the early 1900s, like 1910, 1920, the disease of the day was rickets. And that's a bone disease that was seen in disproportionate amounts in Black children in northern cities. And it's basically where there's bone softening, bone weakening, children have bowed legs, knock knees, different abnormalities at their growth plates. And what they determined, Dr. Alfred Hess was a pediatrician in New York, and what he determined was that rickets could be prevented with both cod liver oil, which contains 400 IU, a teaspoon contains 400 IUs of vitamin D, or UVB sunlight. So what he did a study in Harlem in around 1919, 1920, and he looked at children and what he did was he compared infants. They were mostly Black, and he gave one group of children a teaspoon of cod liver oil a day, and then the other group he gave nothing. And what he found was that none of the children in the cod liver oil group developed rickets, and over half of the children in the control group developed rickets. And he did a similar study in the Marlborough district with Italians and got similar results. So based on that, he concluded that we need to act now and make sure that all mothers are giving their children a teaspoon of cod liver oil a day. And they had all types of programs and pamphlets that the government got on board. Child welfare clinics were on board. So everyone was all unified to make sure that mothers were giving their infants a teaspoon of cod liver oil a day. Well, that same teaspoon of cod liver oil a day, which contains 400 IUs of vitamin D, that actually became the first government RDA, or recommended dietary allowance for vitamin D for Americans in 1941. And it used the value of 400 IUs a day, which is the amount of vitamin D that prevented rickets. So everything was all based on rickets and bone health back then. So, and that was not updated until 2011 by the internal medicine organization that updated those guidelines, and they moved the 400 IUs a day for everyone, and they changed that to 600 IUs a day for I think ages 1 to 70, and 800 IUs a day for if you're over 70, but still really low. And the reason for that, you have to know this piece. In 1971, a group of scientists set out to determine what is a normal vitamin D level in the population. And this was a group of scientists, Haddad and Chu, out of my alma mater, WashU. They tested 40 healthy volunteers, what they deemed 40 healthy volunteers, against 8 really tan lifeguards. Now, when you read the article, the original article, it doesn't mention race, so I'm to assume that they were all white. And so what they found was that for the volunteers, their average vitamin D level was 27. But for the average lifeguard, the really tan lifeguards, their average vitamin D was 68. So instead of them saying that, okay, humans evolved outdoors, so we should be 68, they said, okay, well, normal is 27. And so that was the basis of when we hear this number 27, it was based on that. And whenever they do studies saying what should be a normal population level of vitamin D, it's all based on people that are indoors most of the day. We're not living like we did traditionally. So that's the main issue that I have with the current recommendations and people focusing on bone health.
What sparked that increase from 400 to 600? Did something happen, or?
The internal medicine group that did it, they only looked at measures related to bone health. So they looked at DEXA scans, they looked at all the indicators to determine what a normal or healthy level would be to lower your fracture risk. So that's what sparked it. But again, they did not take into account all the hormonal actions of vitamin D. It's involved in so many other tissues outside of the bone. So that's really was not captured in these current recommendations, even increasing it to 400 to 600.
Hi, I'm Alicia from the Melanin Initiative podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1 minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
Well, your passion is very palpable. And I love the historical journey that you took us on. That really helped shape our understanding of kind of where it started. And I remember that, and it might still be around, that whole saying of that take that cod liver oil every day. But I never knew like the background of it. And so thank you for giving us kind of like almost 100-year perspective, which was really nice. So this next question is a two-parter. So we read that Jasmine was diagnosed with preeclampsia. So the first part of this question is, how do you describe preeclampsia to patients? And then I'll come in with the second one.
Okay, so it sounds like with her symptoms seem pretty consistent, meaning so she had elevated blood pressure, the lower extremity swelling, edema, generally didn't feel well. It's really a problem because the U.S. when we're compared, the United States, our results are compared to the top. We're lumped into with the top 10 richest countries, and the U.S. has the highest maternal mortality rate of the top 10 richest countries, and a large percentage of that is made up of Black women. And in fact, just in my state alone, we have the third worst maternal mortality rate in the country. So that's why I really started this whole journey, because, preeclampsia, that's a big part of it. So, and whether, symptoms are kind of ignored until it's really late and you're developing, liver failure and all types of things, or you're just not really recognizing what's going on, it's a major problem.
Okay, so the second, now we look at Jasmine's symptoms, the fatigue, the swelling, the headaches. How does vitamin D deficiency contribute to conditions like preeclampsia?
Well, the way it contributes is that had she been sufficient in the beginning, she most likely wouldn't have developed it. So I think the issue is that with most health conditions, you have a window of opportunity and to where you can lower your risk. But like once you're delivering and you have symptoms, giving you a big bolus of vitamin D, I'm not sure that would do anything. Because at that point, all the abnormalities have already established, like with the placenta and the way it's implanted in the uterus and just the things that are going on in your liver. So the main thing is for prevention and to lower your risk by being sufficient prior to entering pregnancy and definitely while you're pregnant.
Thank you for that. I'm curious, what started you? So you mentioned that which we've covered quite a bit on this channel, the high Black infant mortality rates. I think we even have a playlist dedicated to that specifically. We've had several people on who are in that space educate us on how dire the outcomes are. And all those people, just like yourself, are in the space working to improve that. And so we've learned so much here on the show. Curious, what sparked you to get into this space? Just hearing the numbers, or did you have a more personal connection?
It was a rabbit hole. And so I'm gonna tell you about the rabbit hole that took this radiologist from early onset breast cancer to vitamin D deficiency. Because you remember, I'm a radiologist and my specialty is breast imaging. So let me tell you a story. So it was a late Friday afternoon last March. I was at the breast center looking forward to getting my weekend started, until in walks the sweetest 31-year-old young lady and mother of two young children with obvious signs of breast cancer. Me and my team stayed after hours to get her biopsy done because we knew the long road that lay ahead of her. Before I walked out of the room, I took her hand and I said, "I'm so sorry you're going through this. I'll pray for you." And I did, and I still do. Then just a few days later, on the very following Tuesday, I was at a totally different hospital in a different neighboring city, and in walks a 32-year-old sweet young lady, also mother of two young children with obvious signs of breast cancer. So what did these women have in common? Besides being in their early 30s, mothers of young children with their whole lives ahead of them, neither of these women had a family history of breast cancer. I mean, in fact, of the 85% new diagnosis cases of breast cancer, they will not have a family history. So while I was happy to pray for these women, I figured that I could do more. So I started reading in the current literature to figure out what was going on. And what I found was that in general, cancers have been increasing in younger people, and scientists don't know exactly why, but some of the possible etiologies they cite include increasing rates of obesity, sedentary lifestyle, smoking, excessive alcohol, pollution. And research is also finding that people with vitamin D deficiency are at increased risk for cancers, including in the breast. And that's what led me to vitamin D, and what I found shocked me. And that's how my journey started a year ago.
Wow, that is really commendable. And yes, you keep reminding us, yes, I'm a radiologist, but it goes to show you, right, that the value that we can contribute to the world, to healthcare, goes beyond our actual title. And so you bring a really unique lens actually to this conversation that we appreciate. Before we move on, I'm just going to go a little bit more in detail about preeclampsia for our audience, because I know they hear it a lot, and it is a serious pregnancy complication. That's why we're spending quite a bit of time on it. That develops 20 weeks after 20 weeks of pregnancy, and just like Jasmine, it's marked by high blood pressure, signs of damage to organs, particularly liver and kidney. And so for high blood pressure in this particular case, it's anything over 140, over 190 on 2 occasions, at least 4 hours apart. They might see protein in the urine, which is a sign that the kidneys are stressed or already damaged. It might be low blood count, like platelets, which help with clotting, elevated liver enzymes, severe headaches. People might have changes in their vision, or might even experience shortness of breath. Might notice some headaches, blurred vision, flashing lights, a sensitivity to lights, just like Jasmine's swelling. It could be in the face, the hands, around the eyes. Could be quite sudden or gradual. Might notice pain in the upper right abdomen near the liver, particularly if it's already being stressed. Nausea or vomiting, not typical morning sickness. Sudden weight gain due to the increase in fluid retention. Risk factors for this, we see it most commonly with those for their first pregnancy, multiple pregnancies like twins or triplets. They already have a history of it. Chronic high blood pressure, diabetes, kidney disease already in their medical history. Autoimmune conditions like lupus or certain kinds of hair loss, thyroid dysfunction. And when it comes to Black and Brown women, yes, they are at higher risk due to both biological and social determinants of health, which we still have to do a whole episode on, but we've touched on it a little bit here and there. And this is important because if it's untreated, preeclampsia can progress to eclampsia or seizures, what we call HELP syndrome, severe liver and blood clotting disorder, stroke, and even that maternal and infant death that we've talked about. Management will typically include close monitoring of blood pressure and some blood work, medications to lower the blood pressure if it's too high, magnesium to prevent those seizures. The only definitive treatment is actually delivery of the baby and the placenta, though timing depends on how far along the pregnancy is and the severity of the symptoms. So for our next question, let's say Jasmine later develops breast cancer. How might vitamin D deficiency play a role in her case?
Okay, so okay, my area. So vitamin D, the way it works with cancers in general, but also specifically breast, is that the vitamin. So our immune cells actually recognize and kill cancer cells in our bodies every day. So we're constantly developing mutations that could turn into a cancer, but the reason why we're not getting a cancer is because our immune cells are destroying them. And the immune cells are under the influence of vitamin D. So, in addition to other signals, so having a sufficient immune system will give you more protection against developing a cancer, because once your immune system is beefed up, they're able to detect the cancer cells that develop and then kill them before they take root. So, for breast cancer, also the vitamin D receptor is present in the breast in normal cells, and in the majority of breast tumor cells as well. So it just means that the receptors there, and that vitamin D works on those receptors. So one thing that I've read recently that they're actually looking at is determining, finding vitamin D, what they call agonists, meaning compounds similar to vitamin D that does the same function, but maybe stronger, to be used in therapeutics. So from a pharmaceutical perspective, to be used in therapeutics in treating breast cancer. And in terms of breast cancer in general, women, there's a high association of women that are vitamin D deficient that have breast cancer. So there's a potential for, if you develop a breast cancer, I would say as you're going through your treatment journey, make sure you get your vitamin D levels up, And there was a study shown that women that had vitamin D levels above 60 had a much lower rate of breast cancer compared to women that had a vitamin D level under 20. So there was definitely a number related to it. So above 60 is what I try to keep my vitamin D level at, above 60. And so if you're on your treatment journey, I would say number one, make sure you're sufficient in vitamin D. I would try to aim for being above that 60. And then once you're done with your treatment journey, continue just staying with a good level of vitamin D. And there has the potential for lowering risk for recurrence. So those are all the ways that vitamin D can interplay and help you throughout your cancer journey. But hopefully the idea is ultimately to prevent cancers from happening, because one of those things that I loved learning about was that when we talk about the first 1,000 days, it's called the Barker hypothesis. And it's this concept that from conception to about the age of 2, a baby's like nutritional and non-nutritional stressors on that baby is going to determine what type of adult diseases the baby develops. And one of those diseases is cancer. So that in addition to diabetes, autism they're looking at, so neurocognitive things, MS, autoimmune diseases, all these things are being impacted by just that first 1,000 days. And one of the nutritional factors, I believe, and so do many others, is vitamin D. So the idea of working in the womb first is to maximize, improve the health of the baby, may long term improve adult health and hopefully prevent some of these cancers. But if you already have cancer, definitely being vitamin D sufficient can help you during your treatment journey and afterwards.
That study that you're referring to, was that a randomized control trial?
Which one?
The one that you said that they found that 60 was a good metric?
I can actually refer you to this. So this was actually, I believe this was probably epidemiology based upon when they compared women's who were above 60 versus those that were below 20, the significant percentage decrease in cancer related to those two levels. But I believe that was probably epidemiology.
Oh, okay. And then when you said it can help prevent reoccurrence in breast cancer?
So for what I'm talking about for breast cancer, so for breast cancer, the whole concept is, so you go through treatment, and I have one of our friends is a radiation oncologist in our hospital.
A what?
A radiation oncologist. So she treats cancers with radiation. So one of my colleagues that works in our hospital. So she's a radiation oncologist.
Oh, okay.
Yeah, radiation oncologist. So she gives radiation when you have cancer.
Uh-huh.
So she's a big believer in vitamin D, and she also lectures about it. And one of her things she always says is, I do all this to treat cancers, but I'm not maximizing things that can help prevent the cancer from coming back. So, and one of the things we talk about with vitamin D sufficiency is the idea that you're beefing up your immune system, because your immune cells need vitamin D, adequate substrate to be healthy. And remember, it's your immune cells that's actually your surveillance system. So if your immune cells are in the, not functioning at the optimal level, you're going to have more likelihood of developing cancers. So that's when we talk about lowering your risk for recurrence, we meaning that by increasing your getting sufficient and providing your immune cells with the adequate vitamin D to be optimized, that hopefully it'll function better in surveilling and killing those cancers before they take root.
And is it safe for women like Jasmine who might already be pregnant to go ahead and aim for that 60 without?
So in pregnancy, we say above 40. So I would say, so in my mind, I'm way beyond pregnancy. So I'm looking at above 60 for my health, but for pregnancy, we just say aim for above 40. That's what they determine is that's the saturation point at which if you go higher, it's not necessarily doing anything additional for the placenta. It's like it's kind of like a threshold. So once you get above 40, that's the threshold. That means the placenta is getting the maximum amount of what it needs from the vitamin D. So yeah, she should, so for her, I would say definitely just target above 40 to minimize her pregnancy type complications.
Thank you so much. I mentioned social determinants of health, and like I said, this is health literacy, so we like to explain things to the audience. And so what we saw is that, okay, so say you saw the two ladies you saw who came into your clinic, you already saw they had a problem. And then we look and we take the steps back and look back, how did we get here? When we look at social determinants of health, we realize that only 20% of what we're doing when you actually interact with us actually accounted for those health outcomes, the preeclampsia, high blood pressure, or the breast cancer. We saw that all these other things, 80% had a much bigger impact. Where you live, where you play, where you work. Sometimes, your zip code, things you don't even have a choice of when you're born. So that's what social determinants of health is. And we try to look upstream on what we can do before that happens. So you mentioned, hey, this is my area. You're doing exactly that. You're saying, look, I'm seeing what's happening at the problem. How can we work our way back kind of to the root cause of the situation? We've talked about your title multiple times. Can you just explain to the audience what it is that you do?
Yes. Okay, so I'm a breast imaging specialist, and what that means is once you start getting mammograms, so the primary way we detect breast cancers is through screening mammography. That's been shown very effective at finding breast cancers. So I'm the person that actually reads the mammograms and also the breast MRIs that you're supposed to be coming in to get yearly beginning at age 40 or younger, depending upon if you have risk factors like family history or any type of genetic mutation or whatnot.
Wonderful. How'd you get into that work?
So I love working with women. So once I completed my residency in radiology, diagnostic radiology, I had a very impactful interaction with a former staff, Dr. Reynolds, Handel Reynolds, and he is what really, kind of led me to thinking about breast imaging. And so once I finished training, I didn't stay on for any extra time, but I got into practice and then I started doing breast imaging about a third of the time. And then I've just increased it from that to where I'm doing it full time now at my current job.
Oh, okay. So after your radiology residency, so you did undergrad 4 years med school, was it 3-year residency?
Five.
Oh, wow, 5 years.
Five.
Wow. And
Yeah.
so then after that, is there like a fellowship? Because you said this sounds like you started doing it, so you just do it more and more. Is there like a fellowship, or you
There,
just?
yes, there is a fellowship, and I had thought about doing a fellowship, but the issue that actually happened was, okay, so my husband is a ear, nose, and throat doctor. He's a surgeon, and he's a year ahead of me. So he finished, and so for a year, and he found a job in a small town in Ohio. And so he moved, and then we had our first son already, so he was 2, and he commuted back and forth on weekends. He wasn't on call, and we did that for a whole year. It was a tremendous strain on the family. So when I was getting, halfway through, I was like, I cannot possibly stay and do another year or go somewhere else and do another year and be apart for another year. So I finished, my residency, and then I got out and got a private practice job. So, but I will say that Indiana University provided excellent training. They have a great breast program. And so even in the months that I did there at IU, I felt very well prepared going out into private practice.
Wonderful. Thank you for sharing that with us, because you're our first radiologist on the show.
Oh, wonderful. Okay.
Yeah. So I mentioned in your bio that you founded Crossroads Health Foundation. Through that, you advocate from the womb to the tomb. How does your work prevent cases like Jasmine?
Well, I'm just getting going with that. So that's something that has just come about over this summer, and we're still pending. So I'm in that process. So my goal for Crossroads Health is to do lecture, because I think the information gap amongst like even physicians is really big. And I think part of what I learned through this whole journey is that for most doctors, you're busy, you're working a job, you're just busy. Like I look at my husband, he has a very busy practice and he has more responsibilities outside of work. So when I get off work, the beauty of radiology is it's like a shift. I clock out and I'm done. I'm living my best life. But he comes home and he has like a couple more hours of charting to do. And he has all this stuff, and he stays up late every night, and it's a lot. So after he's done with that, when does he have time to read the literature?
Mm-hmm.
He doesn't. And then we have games with, our kids we're always in sports. So most people, they're in travel sports, their kids are busy, so I just think for the average physician out practicing, you really don't have either the mental capacity or the physical capacity to do much more beyond your daily job. So I think for those reasons, I think a lot of people don't have this information or don't understand it the way I've been able to devote a lot of time. Like I have a lot of vacation time and a lot of like after work time since my kids are a little bit older to kind of do all this. But so my goal with Crossroads Health is to do more lecturing because I've done lots of presentations and virtual presentations. And so my plan is to try to just do more, to try to just do more education with physicians and then also lay people as well, because I think people have to be their own advocates in general. And, until everyone is up to speed on this, patients may have to drive a lot of this.
Oh, yes. The longer I practice, the more I realize how much patients have to advocate for the care they want. I'm convinced. And yes, just like physicians, NPs and PAs, we also come home with charting. Life is very busy. And so for our aspiring clinicians who are trying to decide what route they're going to go, it is a very busy life. And you're right, you don't have the time to stay on the literature. Even if you attend conference once or twice a year, that's like a weekend. That's,
Yeah.
like there's stuff coming out every single day. And so people like you, we have our medical science liaisons sometimes who will go to a clinic and educate our providers in a way, they take a lot of information and condense it in a way that's digestible so that you can continue to care for your patients. And then actually those of us who go on to get our doctor of nursing practice degree, that's actually what we do. We help to decrease that gap. So our friends who are scientists are going out there and answering questions for the very first time, new knowledge. But we saw that it was taking 17 years for it to reach Jasmine. That's unacceptable. And so you needed someone who could understand that literature, understand what's actually happening in practice. Because in a lab where everything's perfect and well controlled, you can say, hey, this is what you should do. But in clinic, we can say, hey, that's wonderful, but it's not going to work like that here because we're strapped for resources. Someone else might say, well, we have a ton of resources, so we can probably implement it exactly as you described it. So that DMP person translates. Hey, we understand this. We're going to condense it and show you how you can apply it over here and how you can apply it over there. And so that's just like you. That's what I do in my free time, is to condense the information and translate it. And that's kind of a little bit what we do here on this show. So thank you for sharing that lived experience.
Yes, that's interesting you say that about. So okay, so we also have like this translation gap amongst physicians. And so there was a study that was done, I believe maybe like back in 2011, when they determined that the average translation gap was like 17 years. And that was like the time that it takes for new information to become available till it's implemented across the whole country. So like, for instance, when a new recommendation comes out, it takes a really long time, much longer than what most people think, for every single little clinic in every little town to really adopt it. Well, these are people's lives that are being impacted. And I have a really touching example. Me and my husband had a friend, Corey. My husband knew him from elementary grade school. A couple years ago, right before Christmas, he was diagnosed with stage 4 colon cancer. He was 49 years old. And he, I remember, and he passed away about 6 weeks later. He got treatment, but it got worse and he passed away. So, but before that, I remember me and my husband went to his home to sit with him and talk to him after he was diagnosed. And I will never forget, he looked at me, he said, I did not know that the recommendation had changed, that I was supposed to start getting screening at 45. None of my doctors told me. And this is a person that had type 1 diabetes since he was young. So he had all types of doctors that he was seeing. And no one said, okay, look, let's get you set up for your colonoscopy. You're over 40, you turn 45 or what have you. And that was very tragic. And then the one last example I'll give you is, so we have difficulty putting information into practice, but also we have difficulty reversing bad information. And that was that terribly interpreted Women's Health Initiative from the early 2000s that scared women off their hormones, saying that estrogen causes breast cancer. That's been over 20 years, and you can still ask doctors today, and they're afraid that estrogen causes breast cancer. So in a sense, it's been disproven, but it's just, once bad information is put into practice, it's very hard to reverse course in the current climate, the way our medicine is structured.
Yes, thank you for that. And even when we get to our continuing education, there's a point where you can pick what you want to do. So if I just keep picking this thing I like or that I'm used to, still not going to know what's going on over here. So that's why I'm a huge advocate for those of us who are in practice to be on social media. Our clients, our patients are here. They're getting their information from here. And the younger they are, the more they believe this. And so it's so important that we're here as a credible resource to provide that information and to let them know that we might just be right around the corner from where they live, right? You don't always have to go on the internet to find something. So as we start to wrap up, let's go back to Jasmine. She's never had that vitamin D level check. So we did kind of touch on this. What gaps in current guidelines allow this to happen? Do you think we covered that, or anything else you want to add about that?
No, there's huge gaps. It's not a requirement. So right now, unfortunately, everyone is stuck on, they're against routine testing, and the only thing I can come up with the reason why would be the cost of the test, because it doesn't make any sense. So the current recommendation is it's against routine testing. And when you go to American College of Gynecology website, they go along with what the internal medicine people say, which is not routine testing. And then they think that that you can test if the person is high risk. Well, everybody's high risk because we live indoors. Most people they slather themselves in sunscreen. They're covered up. They don't go outside, or they have dark skin. So really everyone is at risk for vitamin D deficiency. So they do say if you're at risk for deficiency to check. But then they also, the amount that they list is so low that it's not going to reach most people. I won't say most, but some people will not reach sufficiency, which is above 40 with like 2,000 IUs. It's just not, and they're not testing to even see if you're even reaching a number. So it's like we're doing things blindly. And what I would say to any physicians is that calcitriol is a hormone. It's a steroid hormone. It's no different than, would you ever treat a thyroid patient without testing their level? Would you ever just say, take some Synthroid and just see what happens? You wouldn't do that. You would test to make sure that the Synthroid was keeping them where they're supposed to be. And that's just what you would do. So it's like the fact that we're treating vitamin D any differently is what is fundamentally wrong.
And when I was talking to you and Dr. Beth Sanford, she mentioned the cost. So typically, I guess when you go out to some big healthcare entity, they charge upwards of $700. But she said it doesn't have to be that expensive.
Now, Beth is more policy, so I don't know the numbers, but I just know what I pay out of pocket sometimes is I'll go to any lab test now when I want a quick, test, and it's $79. So I can get it, out of pocket, not going through any insurance. There are places you can get it cheaper. And even in my city, the community hospital healthcare system, some of the sites, they actually offer even cheaper vitamin D testing at $51. So why you can't get that in the hospitals, I do not know. That's more on the policy end and is complicated, above my pay grade.
Yes, and a quick little check with ChatGPT confirms you can get it as low as $15. So thank you for that. Yeah. And so at the time that this airs, you will have already taken your trip to the Capitol along with the American College of Obstetricians and Gynecologists. How do you, taking stories like Jasmine's, help push for change? And what advice do you have for our colleagues who are new to speaking to lawmakers?
Well, I'm going to do the best I can do. So I've accumulated a lot of knowledge over the last year, and I'm just I feel like I have a compelling story, even a personal story, in having 4 kids that had wheezing and asthma and all those things, and me having a vitamin D deficiency, which I don't know if I touched on that, but it happened. So I feel like I have a compelling story, especially the intersection between maternal health as well as breast health, which is the space that I live in. I just hope that people will listen and be open-minded, because part of the thing is a lot of times people are closed-minded to new information and new ideas. And like, we didn't really learn this vitamin D like this in medical school, at least I don't remember. So a lot of people just kind of like, okay, well, that can't be that important. I didn't learn it in medical school. And so I would just welcome people to be open-minded and just know that there's a lot of information, books and books and books out there just about how it impacts so much of our health, and just try to take information in as you can.
And I will note, policy is super important. That's something we push here a lot. But also, If you can sit on boards that help set our continuing education requirements and our mandates for maintaining certification, that's another way to help participate and change that's sustainable. Because, right, when it's time for me to renew, if it's not mandated, if it's not on that board, it's not, it's not, the change isn't going to happen. So it's important to talk to policymakers and be involved at that level, but also at the level when it comes to, who's making the decisions on what it means for our continuing education mandates and requirements. Real quick, my mom would be disappointed if I didn't bring up since you're in the space of breast health, and we have covered her story as a breast cancer survivor on here with many other women. When it comes to, and she speaks on Capitol Hill quite often, when it comes to dense breast tissue and those women having to go beyond just the standard mammogram. Can you speak to that real quick?
Sure. Well, like in my practice, we are big, firm advocates of having breast MRI, screening breast MRI. So whether you just based on your dense breasts, it lowers your sensitivity for the mammogram to pick up your cancer. And also dense breasts in itself is a risk factor for increasing, your risk for breast cancer. So you really do need to be screening annual with the breast MRI. I have dense breasts and I get an annual breast MRI. And if you do not have, if your insurance will not cover it, at my practice, we do what's called an abbreviated breast MRI, and that's more of an out-of-pocket cost. It's $299, and that'll get you, the test that you need. It's quick, less than 10 minutes, and it's really very important because breast MRI is our most sensitive screening tool for breast cancer. It's far more sensitive than mammograms. So it's well over like 95% sensitive for detecting a breast cancer. So, and it's going to detect those small invasive breast cancers really early when they're most treatable, because if you catch a cancer when it's early, the stage 1, the 5-year survival rate is like 99%. So the key is catching that cancer as early as possible. But for the general population, for sure, screening with mammography is 100% way to go. But definitely if you have dense breasts, you should be supplementing once a year with the breast MRI.
Thank you for that. And 3 takeaways for our audience. And Jasmine?
Know your number now. Okay. Number 2, raise your number with supplementation and sun. Number 3, maintain your number and test yearly. So everyone needs to know what your vitamin D number is. It's not just this, fluffy, I take a supplement. I hear that too often. Know what your number is. Know what sufficiency is for pregnancy. Know what, range is a good range. I tell people I like the 40 to 80 range that you see. So that's what I would say for most people. And then also mammograms saves lives. So get your annual mammogram beginning age 40. Sooner if you have family history. And also for my young women, if you feel something, say something. So all women, if you feel something, say something, because there are too many women that are still coming in with advanced stage 4 breast cancer, and it just should not even be a thing, because we have very good prevention tools, or early detection tools is what I would say.
And how do you address the question on the quality of the supplementation? We know supplements aren't necessarily regulated by the FDA. And so how do you advise people when it comes to choosing a supplement?
I honestly, I would just go by reviews. So I'm not an expert in that area. I would say whatever supplement raises your number to the right level is what I would say. Stick with that. So I'm not pushing any particular product, but I will say if you're taking a supplement and you're checking your number, you're not getting it to where you want it to be, it could be a couple issues. If you have any type of absorption issues in your stomach, like if you had stomach surgery, Crohn's disease, any type of absorption issues, you may be better served by taking the liquid vitamin D. Okay. The liquid vitamin D3 may, increase your absorption. Also, if you're also finding that you're absorbing vitamin D, it could be because you're deficient in magnesium. About half the population is deficient in magnesium. And magnesium is like a cofactor that allows the vitamin D to be absorbed. So if you don't have enough magnesium, your body is not able to sufficiently absorb the vitamin D. So it could be that you need to be on magnesium as well. Magnesium glycinate is what I take 500 milligrams at bedtime. It helps you sleep. And it's also is been shown to be lower your risk for dementia. So that's another thing that I take as well.
How can people connect with you?
Well, I am on social media. at dr.nikisa. And I will be building those platforms here shortly. So that's where you'll be able to connect with me.
Thank you so much. We've learned so much about vitamin D and its connection to our overall health, especially when we talk about women's health. And one thing it uncovered is there's a lot more to talk about, because I would love to actually have you on, not only to talk about, what was the other thing I said you were going to come back for in the future?
Hormones.
Yes, the hormones.
Optional suffering.
Because you are talking about exposure to sunlight and UVB rays, I would love to have that conversation from the derm perspective also, right? Because over here, we're telling everyone to cover up and, avoid the sunlight. And so that conversation really needs to be had together.
Okay, I would love, because I have a lot of thoughts on that.
Okay. Everyone, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, there's still time to subscribe, hit the thumbs up, and interact with our content. Because every time you do that, it lets the algorithm know that this information is important, so that when people like you look for topics like this, we show up higher in the search results. At the time of this recording, we release new videos every Sunday at noon Eastern on LinkedIn and YouTube. And we drop the audio at 5 a.m. on your favorite podcast app, so that our night shift friends can be the first to get something and not the last. We thank you all for watching. We'll see you next time.
Thank you.